for the session to start. So my wholehearted thanks from the scientific committee to all the participants and to the judges. Thank you very much.
Thank you. Our pleasure. Thank you.
We'll move on to our next session, the Young Dermatologists Forum. Do we have everyone here? I think we have everybody. Okay. So we'll start our next session. Can we have a CV slides, please? So this is a very interesting session, the Young Dermatologists Forum. It is a panel discussion which will discuss challenges in setting up a dermatology career post-residency, especially in the COVID era. The moderator for the session is Dr. Sobhik Ghosh, and he, of course, needs no introduction. He's a consultant dermatologist at Wisdom and Apollo Clinic and has been panelist and moderator for a number of sessions. Dr. Sobhik Ghosh, are you audible? Yes. So you can now moderate the session. You can take over the session.
So it is visible here. Am I visible? Hello, can you hear me? Can you hear me?
Unmute yourself.
You are visible and you are audible.
Panelists, please unmute yourselves. Dr. Prerna, you are muted. So I'd like to introduce the moderator, Dr. Sobhik Ghosh, who is a visiting consultant at Amri Hospital and Wisdom Skin and Hair Clinic, and he has been a speaker and panelist in a various number of national and international and state conferences. Dr. Sobhik, am I audible to you?
Yes, yes.
Okay, so you can start the session.
The panelist introduction.
It is supposed to be done by you, panelists. You have to introduce the panelists. Can we have the panelist CVs, please? I'll do it for you. Can we have the panelist CVs, please, from the tech team?
Okay, I am introducing Dr. S.K. Shayyar Ahmed. His present affiliation is Calcutta National Medical College, SR, and he has presented 3 number of national presentations. Next is Dr. Soikot Banerjee. He is currently attached to Howrah Orthopedic Hospital. He has presentation, pre-national presentation and 6 publications. And Dr. Gaurav Roy is RMO of BC Roy Hospital in Dermatology Department. He had presented one national conference.
Good morning, everyone.
Dr. Arunima Dhaval, she is Senior Resident, Department of Dermatology, Sagar Datta Medical College. She has 2 national presentations and 4 publications. And lastly, Dr. Prerna, she is consultant dermatologist at Invita Clinic, Kolkata. She was the university topper and board medalist in MD exam, final exam. Okay. Now I'm starting. Okay. Everyone visible? Am I visible? Okay, I'm starting now. The topic of panel discussion is challenges in setting up a dermatology career post-residency, especially in COVID era. First of all, hello to all esteemed panelists. I am starting the session. So, after residency, after completion of the PGC, students are worried about what next. So after completion of junior residency, in which year did you complete your PGC, and what are your immediate next moves post PG pursuing your dermatological career? Dr. Shoikat. Hello, Dr. Shoikat. Can you hear? Dr. Shoikat. Can you hear Dr. Shoikat? Dr. Banerjee Shoikat there.
Just muted the video.
Okay, Dr. Gaurav, you did your PGC and what are your next moves?
Okay. Good morning, everyone. There's some sort of distortion here. Okay. Hello.
Yes.
So, am I audible?
Yes.
Yeah. So, good morning, everyone. I'm Dr. Gaurav Roy, currently posted as a RMO in dermatology in Dr. B.C. Roy Postgraduate Institute of Pediatric Sciences. So, I'm actually a recent pass out. I have passed out. It has been 2 years since I passed out from SSKM. So initially, I was a batch of 2016 to 2019, and initially was posted as a senior resident at Kagdeep Hospital following the government bond. So the 2 years that I spent there, it was really a long time actually. In terms actually, the COVID situation was at its full swing. Couldn't make the most out of it. There was lockdown. There was nationwide economic and health crisis, and even I had to do some COVID duties when my colleagues fell ill. So initially, my focus on dermatology was not much that. Okay. So I had to pursue what I will say. I had to do some duties regarding COVID. So dermatological OPD was closed in the hospital. I didn't get any much exposure following posting there. So I think I lost some opportunities following passing out. And there was also some sort of decreasing patient pool also. So the 2 years.
How did you proceed after that?
After that, actually, the situation is coming back to some sort of normal. I was posted from there to Dr. B.C. Roy Postgraduate Institute. Now the OPD has come in full swing. So I'm seeing a lot of pediatric patients in there also.
Okay. Dr. Prerna. Hello, Dr. Prerna.
Okay, have you unmute yourself? Yes, sir.
I,
Yes, sir. Yeah,
I think her microphone is not switched on.
Yes, please, Priya, please.
yes, now.
Yes, now it is switched on. Yes, Dr. Prerna, please continue. Somehow not edible. Dr. Shayyar.
Good morning, everyone. Am I audible?
Yes, yes,
Hello.
yes. Good, absolutely.
We have passed out in 2020, and after that, the second wave have come, and we all mostly our posting was in the periphery in rural hospital where we have performed COVID duties. And recently, I have joined in Calcutta National Medical College. So, in the past 6 to 8 months, we have not much exposure with the dermatology, and it was a very tense situation for us that we are starting losing our skills, and there was no other option to learn new things. The bond posting, especially in West Bengal, we all have to face such thing that our posting in such an area where we are less exposed to dermatological patient, mostly the clinical patient, other medicines and gynecological patient, and
Okay,
then
then Dr.
especially COVID
Ornima.
ward.
Dr. Ornima. Dr. Ornima.
Good morning, everyone. Am I audible?
Yes, yes, yes. So just
Yes. So I
short order.
completed my MD last year in 2020. It was right in the middle of the pandemic. So after that, we were posted in as senior residents in rural hospitals, but mostly we were given either general duties or COVID duties. So for me, the next move was to find an attachment to a medical college, preferably where I could get more exposure to dermatology. And so I was in search of senior residency in any of the medical colleges. And so right now, that's what I'm doing.
Moving to the next slide. What do you think? What are the different career options post physician in the field of dermatology? Dr. Shankar? Hello.
Hello.
Yes, yes, Dr. Shankar. Please go ahead.
Yeah. So actually, you can have your there are many career options for following your PGship. You can do job in private sector, in the government sector, or you can be in purely private practice. Many government and private institutes in the country are offering post-MD fellowship, especially also in there are also abroad. You can go abroad for such fellowships, and you can have some clinical dermatology, pediatric dermatology, lasers, and aesthetics fellowships also from within your state, or you can find it in around the country, and also if you go abroad you can have them. So there is also some provision for pediatric dermatology fellowship in national board FNB. I think that there are few seats available in Maharashtra, and you can also have dermatosurgery hands-on training in surgical procedure ranging from months to years. And there is also IITBL grant for observership, fellowship, and also non-sponsored candidates passing from government medical college have no other options other than to attend government board or compensate the government with a huge amount. So hence opportunities are restricted for a non-sponsored candidate, I think.
Okay, thank you. Dr. Shankar, how to choose between academics and practice? How to take the decision whether you will go for clinical practice or you go for academics at a medical college? Hello, Dr. Shankar. Anyone from the panel can answer.
Hello, am I audible?
Yes, absolutely. Go ahead. You're audible. Go ahead.
Yeah, thank you, Shravika, for a warm welcome. And sorry, initially I think my unmute wasn't working. So I'm Dr. Prerna and currently I'm practicing as a consultant at Dr. Sachin Verma's Skin Vita Clinic. And I passed out in 2015. I joined in 2015, passed out in 2018. So after that, I completed 3 years of senior residency. And just now, last month, it got over. Now, yes, it is a tough decision. When you jump into practice, it is difficult to stay in touch with academics, but practice is not a choice. Obviously, we have done MD to practice, but academics is a choice. If one wants, one can always be connected with academics. For example, when I was working as a senior resident in Barrackpur Hospital, there was a huge patient load and I was the only dermatologist there. So there was every opportunity for me to write down several papers because I had all kinds of clinical patients coming there to show, starting from pediatrics to senior, elderly, all age groups and all kinds of diseases were there. So, and moreover, journals are always available online, so we can always be in touch with academics. Now, yes, senior residency, there is.
Okay. So now there are lots of things you can do after residency. You can go for senior residency. You can go for fellowship. You can go for corporate practice. You can go for private practice, or you can acquire knowledge from any expert. So, what do you think? Senior residency is important, and why? Dr. Sayer.
Yes, I think after passing MD, we have at least one attachment where we can learn new things, because dermatology is a huge, vast subject, and we may not able to learn everything during our PG. Like there are different uh, branches, like clinical dermatology, pediatric dermatology, histopathology, aesthetics, photos, fillers, lasers. So we have to learn each and everything with time. So we can fix some time for at least target 6 months to learn one single skill, and in the next 6 months another skill. So how this is how we can develop our skill, and we will not get an opportunity in private practice to learn this. So we have to attach with senior residency at any private setup or government setup to learn this.
Senior residency is purely helpful. Now, what are the branches of fellowship? I think Dr. Gaurav has already mentioned dermatopathology, pediatric dermatology, cutaneous surgery, lasers, injectables, aesthetic dermatology, procedural. All of these fellowship are our country and abroad also. But in this COVID era, in contrast to this COVID era, going for international fellowship at that moment is something troublesome. So once COVID situation settles, then fellowship will be a good option. And see, I think laser and cutaneous surgery fellowships are given in Singapore and Bangkok. So acquiring skills from experienced dermatologists. What is your opinion regarding that, Dr. Urudima?
I think during our PG ship, we don't have a lot of choice into what we want to, which field of dermatology we are more interested in. We don't have much scope of delving too much into that. So I think post PG is a good time to explore the fields that we are more interested in and decide on who we would want to follow the footsteps of, and maybe working under that person if it is possible. It is not always possible, but if it is possible, then it is definitely a big advantage, I think.
Okay.
So can I add here something?
Yes, yes.
Yeah. Actually, working under an experienced dermatologist has got some pros as well as cons. I would like to discuss the pros first. First of all, you get to honor your skills, what you have learned during your PG shift days. You can get good guidance. You can observe treatment protocols of rare diseases if available at the clinic or there. And you can also learn some procedures that you are not exposed during your PG shift days. You can share clinical experiences with an experienced dermatologist and clearing the backlog in clinical and aesthetic procedures, which you have had during your PG shift days. And you may also learn hands-on procedures, which you were deprived during your PG shift days if you're from a government medical college. So there may be some cons also. Actually, there may be many aspirants in the same center, so there are lesser opportunities to learn. And private clinics may lack the ample exposure of a variety of patients. That is my point of view.
So, help from senior experienced doctors are always helpful. But what do you think?
Sorry. Hello. Sorry. Could you please repeat the question? I didn't follow.
Yes, yes. Do you think godfather or godmother is very much important in our dermatology career? Getting help from the seniors is always helpful, but do you think that godfather or godmother is important? On a lighter note, I'm asking.
I would like to speak at last. I would like to have some opinion from the other panelists. I would like to speak later.
Yes.
Yeah.
Dr. Solkar. Dr. Solkar. Here, Dr. Solkar. You are not audible. Okay, go ahead.
Hello.
Yes, go ahead.
Yeah, may I?
Yes, sure.
Yeah. Okay, actually, from my point of view, I think yes, there is a need, especially your professor who during your PG shift days may fulfill the purpose. He actually knows your weaknesses, your strengths, and he can guide you accordingly. Proper guidance, even after PG shift, is important, I think. Guiding for opportunities and helping to shape up your practice, understanding your needs and recognizing your skills and supporting you morally. That is very important. So a healthy fatherly relation or a motherly relation required for proper guidance in shaping our future and practice. I think there is a need of godfather in practicing dermatology.
So, what is your preference? Private clinic or corporate sector? Dr. Prerna?
Yeah. So, whether a godfather or a godmother is necessary in practice.
Private clinic or corporate sector?
Am I audible?
Working corporate sector or you having your own private clinic? What is your preference and why?
Shravita, am I audible?
You are audible. Please go on.
Yeah. So I think a godfather is not necessary, but a mentor is definitely necessary because once you are out from PG and you step into practice, in government hospital we don't learn the art of patient handling and patient counseling. That is very important. So you need a mentor whom you see how they work in private practice, and so you learn a lot from that. So maybe a godfather is not necessary, but a mentor is definitely necessary in your initial years to learn from him how to handle patients in private practice. And about this private clinic or corporate sector, personally, I feel a private clinic is corporates do not take up freshers, they want 5 years of practice. And secondly, skin is a subject where you need to do minor procedures, which is more convenient in a private clinic than in a corporate hospital. Because corporate hospitals, one simple peel if you want to do, you have to book the OT, you have to take OT charges.
Okay, you have explained very well.
From the patient, it adds up to a lot. So personally, for me, private clinic is easier compared to corporate.
Let me go little faster. So how does marriage change the perspective of dermatologist area? Dr. Rubina?
Well, I can't speak from personal experience on this matter, but
No,
yes,
just your
marriage.
opinion. Dr.
Yeah, marriage in case of, especially in case of females, is a problem because you may have to shift base, like you may have to shift to a different city or something. And in that case, if you've already set up your career somewhat in the previous place, then setting it up all over again in a new place can be difficult, and there can be language barriers if you're shifting to a different state even. And even the patient profile may change. The kind of patients you saw in your residency during your residency days, it may be completely different there, especially if you're shifting to a different country, that is entirely different there.
So, Dr. Prerna, what are the difficulties you faced during COVID pandemic as a dermatologist patient?
Yeah, so one difficulty was obviously you could not connect with the patient to the same extent because you are wearing a mask. You have to sit away from the patient. You cannot go and touch him directly. You have to first be sure that he doesn't have COVID symptoms. And then if at all any procedure is required, you first have to ask him to do a COVID test maybe, or you have to take a declaration that he does not have symptoms or he did not suffer from COVID in the recent past or present. So there were hindrances during the pandemic situation as regards practice, but then what we could improvise upon was our clinical eye, as in you have to diagnose more based on what you see rather than what you feel or palpate. Secondly, you have to also take the help of certain investigation. So
Okay, so we have almost similar experience. So, Dr. Freda, how have you dealt with the finance? Have you dealt with any financial loss than the previous years?
God has been very kind. I have not really suffered financial loss, but yes, I have not been able to progress as much as I had expected myself to, and as much as I had foreseen myself pre-COVID in the first year of my practice when I was just out of MD. That year was free of COVID, so I had expected myself to grow more, but I have not been able to. So if that can be counted as a loss, then
you didn't have any financial loss. But actually, in the study, it was seen that 80% physicians saw a drop in patient volume. What are your new cases in dermatology associated with COVID are coming? And please mention 2 or 3. Dr. Banerjee. Dr. Soika. Anybody can answer. Hello.
Hello.
so yes, the most common case that I have been seeing after COVID, 2 things. One is an increased occurrence of herpes zoster, maybe because of immunocompromisation or because of poor nutrition or post-COVID weakness and all. And the second thing is urticaria. So there has been an increase in urticaria cases.
Yes. Articarial lesion.
I'd like to add another thing that I've been seeing post-COVID, the hair loss.
Yeah, that is an important part. Telogen effluvium, many patients are reporting with telogen
and it's
effluvium.
continuing for more than a year after the illness. So, and it's not even responding very well to most of the common drugs we use. So
Even
that is one of the most common things I've seen.
Articarial lesions, viral other infection.
Actually, there has been a shoot up in cases following post-COVID vaccination in herpes zoster, I think. Many patients are presenting with herpes zoster following vaccination. Okay. Okay, that is the one another thing. And being in a pediatric hospital, I find that many patients who are admitted in the ICU or SNCU who are under life support, they are developing some sort of purpurity rash, who are COVID positive and developing purpuric rashes. And also there is a rise in exanthematous cases also in children who are tested positive for COVID.
Okay. So, Dr. Orniga, are you practicing telemedicine?
Right now, I'm not
Dr. Orniga?
haven't started practicing telemedicine yet because
Anybody doing?
Yes, I do little bit of telemedicine,
Anybody?
and I think it has almost become a very important and integral part of practice now, because even patients are hesitant to come to the clinic, especially follow-up cases. New cases still come, but follow-up cases prefer to do it on video call. So
This
I
is an
have
advantage. And any
telemedicine.
disadvantage in place? This is the
Yeah,
advantage. Any
actually,
disadvantage
still in India,
yes.
I think it's not an universally accepted mode, at least for now. The clinical diagnosis may be compromised based on media clarity, I think. Even the rural patients who have limited internet access and device knowledge, they cannot get access to their physicians from a long distance. And it is also not gratifying for a clinician, I think. Also, that's my point of view. And there are some sort of medical legal aspects also. And there is also frequent drop of signals which hampers with the diagnosis. There are many cases where you need to palpate as well as to see with a hand lens or with even do a dermatoscopy in order to diagnose the case. Such cases can be a bit difficult to see from tele-dermatology point of view.
You are seeing a patient in a three-dimensional, in a two-dimensional mode. So this is a problem for me also. Dr. Prerna, what do you think? Does COVID pandemic has affected cosmetics or aesthetic dermatology?
Yes, so this is one arena which has really come down after the COVID pandemic, procedural dermatology, because patients, one thing is socializing has reduced with the normal population, so they are not as keen as getting cosmetic peels done, or improvement of laser with an improvement of scars with laser procedures, or removal of hair with laser hair reduction. So these things have really come down. But yes, some procedures like fillers and Botox, which has to be done once in a year, patients are coming for that because they know they just have to come one time.
Dr. Sayyar, your view?
Yes, definitely the number of patients has reduced very much for this procedure. But I am doing some procedures like radio frequency and ET and biopsies in hospitals. And even in government seva, there are very less number of patients for procedures also. As it is
not really perfectly a good time for the doctor to practice aesthetic dermatology.
Sorry.
So it is not a good time for the doctors who practices only aesthetic dermatology.
Yeah, I think so at least.
Yes. Now let us come to the summary. It was given in EADD journal. So, what is the dermatological clinic and surgery? What should be maintained there? Non-urgent outpatient visits should be deferred. Keyword screening at the entry of the clinic should be done. Physicians should stick to personal protective equipment. Dermatological surgeries should be restricted to urgent conditions, and cosmetic complaints should be postponed. Consider telemedicine and virtual clinics for non-emergency cases and follow-ups, and avoid dermoscopy for all COVID-19 confirmed patients. So, in building your dermatology career, I think you need, all people need, that is, you have to choose very early that what is your actual interest, academics, private practice, or solely aesthetic. You should have patience, calmness when seeing patient, and consistency, confidence, and most importantly, you have to be courageous. Okay, it was a nice interaction with you all. First, I think first 10 to 15 minutes, there are some problem in connection, but last portion, we really enjoyed. Anything you want to add, Dr. Prerna?
I would just like to say this last slide has been really well summarized because as a fresher, I started my own clinic called Skintastic Skin and Hair Clinic and EM Bypass. And the most important thing that I realized was perseverance, because initially 1 year, obviously, there were like 1 or 2 patients coming down in a week. But with time, definitely with COVID, without COVID, with any kind of flood, with any kind of disaster, with any kind of downfall, patients will definitely increase because mouth of words does spread. Even in today's era, word by mouth spreads, and if you treat well, one patient will get you 2 patients. So patience is the key. You have to be calm, you have to build a bond with the patient such that he is so happy with you that he goes back and brings 2 other patients to you, and gradually the practice builds. So, and confidence definitely comes when you have worked with somebody as a mentor whom you have seen how to deal with patients. So initially when I had joined Bond at my rural service, I was not really confident about interacting with the patient, about cracking a joke in the middle of the consultation. But when I saw my mentor doing this, I realized that this is the best way to catch the attention of the patient, to build confidence in the patient that you as a doctor can treat him well and he has come to the right person for the treatment. So this confidence develops when you really observe your mentor who has been in practice for long, and you take that from him.
And at the initial days of practice, patient number may not be very large.
Yes, that is definitely going to be less, but it will grow.
Ultimately, in 3 to 4 years or 5 to 6 years, it will prosper definitely.
And yes, the last slide, showing the courage. You definitely have to have courage to treat the difficult cases, because if you want to play safe and if you let go the difficult cases, you will never be able to grow out of your fear.
Yeah, the take home point is that patience bring patients.
Okay. You have to be courageous to practice in the middle of the city. No fear about that. Handling different types of patients, and you should be confident. Definitely. Okay. I want to finish this.
Thank you everybody for such a wonderful. Thank you everybody for such a wonderful session, for taking up very pertinent questions. Thank you, Shobhitra, for moderating it so well. Thank you all the panelists for being a part of the session. And with this, I would like to move on to our next session, which is the e-poster.
Thank you all. Thank you so much. Thank you.
Yes.
And in fact, there is no indication